Hello, good evening. It's Dr. CHUDI UFONDU of Snowspirations Global Health Solutions. It's such an amazing Sunday evening, and I had an opportunity to talk about the topic of today, which is on COVID and COVID vaccines, the effect of COVID and COVID vaccines on fertility, both the male fertility and the female infertility. Now, what we're going to discuss this evening is strictly going to be on facts. So as of this moment, we haven't really had any conclusive study that came out categorically and connected COVID-19 to fertility directly. But this is what we know. COVID-19 as an infection is a systemic infection. So systemic infection means all parts of the body will be affected. Now, mainly the place that COVID-19 will have effect are places that have so many receptors. So there are things we call receptors in the body. Receptors are the things that the germs, like viral germs, bacterial germs, fungal germs, will happen before they will gain access to the body. So the reason that so many people that have COVID-19 will come down with pneumonia is because when you get to the lungs, they have a lot of receptors for this COVID virus in the lungs. Now, as of this moment, what we know, when COVID attacks you, and depending on the severity, it's going to affect the totality of you. So people that will have fever, definitely is going to knock them off. So it's going to come with a lot of symptoms, respiratory symptoms, generalized body weakness. Pretty much every aspect of your body will be affected. Now, what we don't know for sure, it's how long the effect of COVID will affect your reproductive system. And if it's an acute thing, if it's a chronic thing. So currently there are a couple of studies currently undergoing a lot of scrutiny. But what we know for sure, as of this moment, we can categorically say COVID affects female infertility. COVID affects male infertility in this way. So we can't say if it affects the sperm parameters, or if it affects the eggs, or if it affects the tubes, or if it affects the womb. We can't say for sure. But what we know for sure is the fact that if you happen to come down with COVID, the severity of COVID will lead to a couple of complications. So if you have an overwhelming COVID infection in your lungs, definitely you might ending up in the intensive care unit. They might likely intubate you. You might likely need a lot of palliative and resuscitative treatment. But if you have a milder form of COVID, you can actually stay back home and you can recover. So it depends on your immune system and it depends on the individual. So COVID effect, it's individualized. So there are some people that might even be in the same family and COVID can affect them differently. But borderline, for now, we can't say for sure if COVID is going to affect your fertility as a man, or if COVID is going to affect your fertility as a woman. Until we know for sure, we cannot assume. But please, what I will tell you right now is to be careful, especially with the emerging and currently trending Delta strain. The Delta strain is deadly. So anywhere you see D, remember deadly. So keep on practicing the protective measures. Think public health. If you're going to be out there in the public, protect yourself, protect other people. So still keep wearing your facial mask. Observe your constant, current, frequent hand washing. Now, top on the list, we have availability of vaccines. So I'm going to say this as a medical practitioner from my experience. Any vaccine, it's better than no vaccine. Whether it's Pfizer, whether it's Moderna, whether it's AstraZeneca, whatever it is, you are better served having any vaccine compared to not having it at all. The severity of COVID will be more in people that are not vaccinated. And it's still an evolving thing. So the fact you have vaccines for COVID doesn't mean you might not come down with it. You might still come down with it. But guess what? The severity of COVID, when you have your vaccine, it's kind of mitigated. So the vaccine, it's not perfect, just like anything in life. In cold season, some people will get flu shot, but they will still come down with flu. And these are the things that can kill. So what we need to do is to be conversant with precautionary measures. So right now, thankfully, what happened in 2020 is not happening in 2021. But the Delta strain is also causing a lot of, concerns. So personally, I would recommend you take your vaccine any which way. If it's Pfizer, take your Pfizer. If it's Moderna, take your Moderna. If it's AstraZeneca, please take your AstraZeneca. You are better served taking the vaccine compared to not taking it. Especially if you have to mingle with people, so people don't wear their facial mask. People are easily exposed. Some people don't even take this serious until they come down with it. Now, if you happen to have an opportunity to take the vaccine and you didn't take the vaccine and you come down with the deadly strain and you end up in the ER, guess what? They will still try and do whatever they will do to save you. Right now, we don't have a categorical particular treatment for COVID that it's highly 100% effective. There are still so many experiments going on there. So you're better served doing the right thing. Now that leads to the next question. Can COVID vaccine affect fertility in a male or a female? The jury is not yet back. So we can't tell you yes or no. But here's the deal. The decision of taking COVID vaccine is strictly an individualized thing. But as of today, so many people that have gone through the vaccine are currently doing well. So personally, I will tell you to go and protect yourself, because you wouldn't like what will happen when you end up developing the problem. So directly, COVID vaccine do not affect your fertility. It doesn't have effect on your fertility. Okay? Now, that's for now. So maybe tomorrow, if anything comes up, we can decide to see if it has effect. But for now, the jury is not yet back with categorical statement on whether COVID vaccine affects your fertility or not. But my recommendation and my advice, so long as you're not living in isolation, because when we talk about public health, you see, public health is everybody's health. So when we are telling you to cough and cover your hands and wear your facial mask, it's not necessarily all about you. It's more about the people out there. It's more about your loved ones, your aged parents, your grandparents, your friends. So there are so many people that might not have the same immune system like us. And if we're not careful, our being carefree can affect their own health. So two statements. COVID as an infection might likely affect your fertility to an extent, but it's not yet defined. The reason is because people that have COVID can come down with fever. Fever on its own is an isolated factor that can affect male infertility. When you have fever, temporarily your sperm count will be reduced. Temporarily there will be increase in your temperature, and production of sperm doesn't do well when you have heat out there. So sperm and heat are not friends. Anywhere we have increase in your temperature, it will affect your production of sperm. Now, on the other spectrum, we don't know exactly how COVID will affect female infertility for sure. There are so many studies still going on out there. But what we know is the fact that if you do better and you protect yourself by taking precautionary measures, then going for the vaccines, if you happen to come down with COVID, the severity of COVID will not be that bad compared to the severity in a person that didn't take the vaccines. So be careful. There are so many conspiracy theories out there. There are so many propaganda out there. The fact you're not contracting COVID today is not because you're the smartest. It's not because of all those theories out there. There are so many things we don't know. But you do not want to take chances, because as I'm talking to you right now, there are so many people that are struggling with their lives, and you don't want to be in that category. Okay, so thank you so much for coming. This is a very important topic. So before I go, please make it a point of duty to click on the subscribe button. Also click on the notification so that anytime I call live, you will have an opportunity to follow me. Thank you and enjoy the rest of your evening. Bye-bye for now.